Each year, the March of Dimes releases a report card to shine a light on maternal and infant health. And this year, New Jersey was ranked a C+.
We still have too many babies that are dying each year. For example, 2 babies die every hour in this country around the clock. Now, we start to break that down. I'll tell you, for New Jersey, for example, in terms of preterm birth rate, we've rated New Jersey C+, which is pretty much the same as last year.
The rates of maternal and infant health are unacceptably high. Approximately every 12 hours, a woman dies due to pregnancy complications. And this has become a priority for First Lady Tammy Murphy.
New Jersey currently ranks 45th out of 50 states in the nation for maternal deaths. That means that 37 women die on average for every 100,000 births here in New Jersey.
So we spoke with an expert who can break the data down that was found in the report.
Infant mortality is when a baby is born and, due to unfortunate circumstances, aren't able to see their first birthday. 1 out of 10 babies that is born in our country is born preterm. Now, that's alarming because it's 5th year in a row that we've seen the rise. We believe there's a lot of factors for that, including the increasing age at which women are deciding to become pregnant.
With that, the United States is facing a health crisis fueled by an equity gap that exists in our country.
This is, without a doubt, the widest racial disparity in the United States of America, and it is obviously unacceptable.
I think the work that is happening now with the focus and emphasis of the governor's office and the First Lady's office in New Jersey, I think First Lady Murphy is doing a phenomenal job in not only bringing to light, but also bringing partners together within the state and working with federal partners to be intentional about eliminating disparities. If you are Black, you're 50% more likely to see the preterm birth of your child. We certainly see those statistics play out in New Jersey. We see those statistics play out in New York. 48% higher rate amongst Black babies compared to others.
While there is no single cause to this complex health crisis, there are several contributing factors.
We know that literally a baby in New Jersey died every single day in 2018. And the unfortunate fact is that if you were a Black baby, you were almost 4 times as likely to die as compared to a white baby. New Jersey is one of the states, as is New York, that has expanded Medicaid. We know Medicaid expansion works. Both the states have also provided extension of coverage beyond 60 days postpartum to help women cope with their conditions that may happen even prior to pregnancy oftentimes, that include diseases like hypertension or diabetes, obesity, but also mental health and substance use.
And now there is additional concern for mothers and babies in the middle of a global pandemic.
6 out of 10 deaths that happen as a consequence of childbirth are preventable. Not only is COVID life-threatening and dangerous for pregnancy, because we've seen that the likelihood of hospitalization, being on a ventilator in ICU, as well as dying, is much more if you have COVID and you're pregnant as opposed to not having COVID. And the second aspect is we're also seeing in those individuals increase in preterm birth rate. And we know the consequences are dire. That's evolving data that's coming out to tell us that. So it's very important that those mothers those women who may be pregnant at this time must ensure that they're taking every precaution possible to not get infected with COVID.
For this year's report of March of Dimes or more information on Tammy Murphy's Nurture New Jersey initiative, you can visit our website, njnn.tv. Reporting for New Jersey News Network, I'm Kimberly Kravitz.